Dear gynecologist, how does it feel to be surrounded by vaginas all day and then interact with in a non-professional manner? Has it ever lowered your libido or made disinterested in someone? Male Ob. Gyn here. As others have stated, it's all about compartmentalization. At work, I'm just a clinician and it's all business. You have to be able to separate your work from your personal life. If I didn't think I could do that, I would have probably ended up in a different field. Never a time where I would say it lowered my libido, but certainly, there have been cases where I silently gagged and thought to myself, oh God, why? I'm a CNA and I've seen more dicks than a hooker. Aside from never, ever wanting dick pics, my work doesn't affect my home or my sex life. I'm a gynecologist. I can guarantee there is no crosstalk between my work brain and home brain when it comes to vaginal exams, surgery, etc. You would go absolutely nuts if you didn't compartmentalize. You're viewing this patient in a purely clinical manner, and you're really just focusing on treating the situation. The exams obviously serve a purpose, so I'm spending my time figuring out if I can feel something pathological, feel a baby's foot, etc. etc. Occasionally put off of my lunch, though. Now noticing a distinct lack of gynecologists on Reddit. Not a gyno, but I'm a general practitioner. I do lots of vaginal and rectal, and scrotal exams every day. It's never been a problem for me or my sex drive. I think the human body is amazing in the way that it forms and functions. So I've never looked at genitalia and thought that's an ugly ass vagina. I have thought that's an ugly ass vaginal tumor. Body parts are not nasty, their pathology often is. Female gynecologist here. Username checks out. A body part is a body part. The vagina needs care like anything else. I personally think smelly feet and weird mouth things are way worse than most vaginas I've seen. I'm a family medicine physician, so not a gynecologist, but do plenty of vaginal exams. I think the overall problem that may lead to decreased libido in this situation is the emotional blunting that occurs during medical school and residency. You see so many sad situations, take on so much stress, and make so many sacrifices that you just become pretty numb and forget how to show emotions, seem interested. Anhedonia is basically baked into your system, which might lead to a decreased libido. Not a gynecologist, but a doctor who has spent time rotating through OB/GYN. Bodies are bodies. Sometimes things go wrong, and most of the time disease is gross, whether it's a lung thing or a skin thing or a vagina thing. I compartmentalize it to a work box in my brain because I'm focused on working out what the problem is clinically and thinking about a treatment plan. I can guarantee you that whether I'm examining your vagina, breasts, rectum, penis, I don't give a flying about what it looks like and will still eat my lunch and go home and have sex with my partner that day. As a side note, I really wish women would stop apologizing for their bodies to the doctors, nurses. I do not have any expectation that you would have shaved, waxed, and I am aware that bodies grow hair. 0 men have ever made a comment to me about their hairy sacs or erections during my examination. Gynecologist here. It's all about compartmentalizing work versus home. Looking at an undressed patient is a purely clinical experience, and it doesn't influence me outside of work. Not everyone can compartmentalize things like that, so it's kind of a prerequisite for the field. I worked in a dissection lab where I watched my friends dissect the vaginas and penises of dead bodies. It was fairly easy to disconnect, but I didn't eat meat for like a year. I am a gynecologist, and have 0 libido issues. Mind you, I'm a straight female, so only interactions I have with female reproductive organs that aren't my own are purely clinical. As someone else already stated on this thread, you compartmentalize in medicine. Every patient I see I view 100% clinically, as do all of my colleagues. As a physician, every part of the human body is just a part of a human body. It's not sexualized. I have no idea, but was once invited along with my husband to a sponsored dinner where a psychiatrist colleague of mine was giving a presentation on mood disorders to a group of OB/GYNs. At this time in my life, I had had 1 baby. The group of OB-GYNs had a policy that during pregnancy you would have an exam with each of the doctors, midwives, so you'd be familiar with whomever was on call when it was time for delivery. So here I was, out to dinner with all of these people. I was sitting there listening to the presentation, enjoying my dinner, when all of a sudden into my head pops everyone here except for my psychiatrist friend has seen my vagina. It was horrifying. Now I can look back on it and laugh, but damn if that was not one of the more freaky moments of a lifetime, and I will smack the person who comments that I should have gone ahead and offered to show it to him, just so everyone was even. I went through IVF to have a child and there was a whole team of people helping us out. Didn't spend that much time with any one doctor. I was at a friend's baby shower 2 years later and kept looking at this woman who seemed familiar. All of a sudden I realized she was the doc who had actually shot the embryos up into my uterus. I impulsively yelled out, "Hey, I know you. You got me pregnant." Let's just say the party chatter came to a screeching halt. One of my friends is a male gynecologist. It seems it's like any other doctor that is affected by work, it's the baggage of what they deal with that bogs them down. One day he asked the group if we can go out because he had to deal with a particular shitty day. General gist, he gave us woman with HIV from cheating husband. A pregnant woman finding out results that her baby is not viable and will die. He had to drain an abscess in a particular type of infection. But we did have a talk that he really doesn't sleep around because of what he knows about all kinds of vaginas. I don't think that's abnormal. I get tested and expect partners do the same. Not a gyn, but I am a nurse. On my most catheterization day, I cathed 4 men and 1 woman. For those keeping track at home, that means touching and cleaning and shoving things in 4 different penises. Still went home and my boyfriend, because once the scrubs are off and my normal home clothes are on, I'm not at work anymore and can turn my work brain off. I will say it's weird seeing my boyfriend at work, and it feels odd to kiss him, because when I'm working I'm in work mode and can't be not professional. True story. 30 years ago I worked at a bookstore and my wife's OB-GYN, who had delivered our daughter just 1 month prior, walked in and purchased several an issue of Penthouse magazine from me. He didn't recognize me at all, or if he did, he played really cool at pretending he didn't. Gynecologist in my hometown had 10 kids, so it evidently didn't kill his libido. So I was a medic in the army, and I worked in a women's health clinic for a while. Also in my general family clinic I worked in, I was with the only female provider in the clinic, so we often got female patients referred to us. Regardless, I was a very hua soldier, and I got a lot of skills taught to me, and was eventually doing well women's exams on my own. So while I'm not a gyno, I played the clinical role of a gyno relatively often. I'll kind of give the answer you're looking for. I worked with the healthiest population in the world. My soldiers were mostly 18-19s or young 20s. They were mostly fit, healthy, and in shape. Many of them were good looking, and because they're healthy most of them don't have crazy things going on with their vaginas. They're seen for annual exams 90% of the time. To make things worse, many of them were my co-workers, meaning I saw them on a daily basis outside my clinic. I saw them in PT, I saw them in classes, I saw them at briefings, and we went out and partied together on weekends. So the compartmentalization everyone is talking about was very important, but also kind of difficult. I never negatively impacted my libido, and I'd be lying if I said that when my doc told me SPC, Smith is coming in at 13:30 for her well women's, if you can take care of them, the little voice in my head didn't go yeah. It's worth noting I was married at the time, so straying thoughts were irrelevant because I'm not a cheater and the stirrups aren't the best place to ask for someone's number regardless. But when the patient gets to the room, all of that disappears. You've got a patient, someone who is giving a profound amount of trust in you to do your job properly, appropriately and effectively. You give instruction, you're respectful, and you get it done as quickly as you can. I've had patients hit on me while I'm visualizing their cervix. I've had patients smirk when I'm doing breast exams. And I've had soldiers come up to me days, weeks later and mention it. It has made me disinterested in someone in a platonic way. I had 2 soldiers, a male and a female. The female got chlamydia and was instructed not to have sex for a week after treatment. She ignored and boyfriend came in with chlamydia a week later. He was given the same instruction. Ignored. She came back a week later. Vice versa, vice versa. We ended up treating them like 4 times and gave a direct order not to have sex under threat of UCMJ. I'm honestly not even sure we were allowed to do that. I couldn't be friends with her after that, just disgusted by how liberal she was with getting her STD. Just use condoms. So really, the little kid in my brain will always say it's so cool I got paid for 4 years to palpate breasts and look at pussy. But the professional in me was relatively unfazed by on in a day-to-day basis. I took my job as a medic very seriously and had a lot of pride in the profound amount of trust my soldiers put in me, especially when we were deployed. Being called Doc, and knowing these soldiers trust you with your life was everything in the world to me, so I would have never tainted it because haha boobs. I'm a cis, hetero, male gynecologist. Sex is contextual. The context of the exam room, hospital is completely asexual, and so exposure doesn't affect my sex life either way. The call schedule, on the other hand, can definitely make it difficult. In at least 2 occasions I was definitely subject to a creepy male gyno. One lost his license only a couple of years later for being inappropriate. I've mostly gone to females as I've gotten old, but I've had a couple of the ladies be nasty as well, saying mean things. Often wonder what it is that brings folks to this line of work. The first obgyn I went to was a woman who also treated my mom, and she was a total asshole. I was honest and informed her after I became sexually active as a teenager and asked for an STI screen, and she refused by saying she'd have to tell my mom if she ordered that. I only went to Planned Parenthood for years because of her shitty and unprofessional behavior. I've always wondered if doctors and surgeons think differently about people. Do they start to see people as just walking sacks of meat and organs because technically that's what they are? When I'm at the hospital, yeah, kind of, you have to turn your compassion back on. It's very weird. When I walk into a patient's room, they are very real, they are there, I care about them, I'm kind and polite, and I genuinely want to do anything I can to help them. The moment my foot crosses the threshold out of the room, they turn back into a room number. I walk out of the hospital for the day and I do my best to forget everything about them. You don't want to carry these people with you, so once you're outside of the job, people are people and you treat them however you would treat people otherwise. When you're in the halls of the hospital, everyone is a faceless room number with a diagnosis. When you're in the room, that person is the most important person in the world. Totally separate. I take care of men and women. Date my boyfriend. He's learned that the penises I see at work aren't a threat. Totally different mindset and approach. It's just a separate world from my personal life. Now, on the other hand, I'm forever scarred and do not eat cottage cheese in any way, shape or form. Also only eat top-tier sushi. No time for fishy smell outside of work. Dude, family medicine, GP resident here. I remember in med school during labor and delivery months I had zero libido. It just killed it for me. No interest in sex. No interest in porn. Nada. I was not asexual, I was completed disinterested. Then residency came and it just became normal. Between seeing enough volume through desensitization and the slow deadening burnout we all experience in residency, I could see some impressive tear during labor or some unpleasant discharge in clinic. But hey, doesn't impact me, I got a life to live after this shift. Thanks ACGME. My wife scared her gynecologist and had to find a new one. He did not find it amazing. She is a pretty good ventriloquist. Gyno nurse here. There is work vagina and home vagina. They have nothing to do with each other. No vagina I've seen at work has affected my interactions with home vaginas. It's like asking a mailman if his job has made him less interested in receiving mail. They all just letters. Some of them make me feel good and some of them don't. I don't care what's inside someone else's mail. It doesn't make me feel good or bad. It just makes me feel like getting paid. I remember when I was like 10 and I found out what a gynecologist does. I proudly told my dad that I had figured out what I wanted to do when I grew up. He told me that I'd probably see a lot more stuff I didn't want to see than stuff I'd want to see. So now I'm in my 40s and middle class. Thanks, Dad. Not a gynecologist but more or less a nurse, so take your gyno patient's average and add at least 20 years for me. The only one who thinks this is even remotely sexual is the patient. I've been hit on a few times and was even offered to marry a daughter from this immigrant family, no idea where they were from. You get pretty used to seeing naked people. Once you put those gloves on, I go into professional mode, if that is what best describes it. I'm there to do a job, and that job most often is cleaning whatever is inside there. Whenever I have a patient where I feel it might be awkward for me, I ask one of the female colleagues to do it. Awkward boner on patient side is fine and normal. Awkward boner on nurse side should be avoided at all costs. Apart from that, it really is just a flappy place that need cleaning and hopefully isn't infected. I'd like to end this with saying, the people you get to see naked at work are never the people you want to see naked at home. Not a gynecologist, but a CNA who wipes booty and such most of my shift. It's not sexy. I'm providing vital care. It's only weird if you make it weird. And I'm definitely not thinking about my residents when I'm having fun time off the clock.